Hi Brian, I'm Liz. I'm going to be performing a cardiovascular assessment on you today. I'll start with, have you have any family history of heart attacks or hypertension, high
No.
blood pressure?
No.
Are you currently a smoker?
Yes.
And how much do you smoke per day?
Half a packish.
Okay. Have you currently having any complaints of chest pain, palpitations? No? Okay. We've already done your blood pressure and that was fine. Your heart rate was okay. I'm going to start by just inspecting your chest.
Oh yeah, oh yeah.
Look for any visible PMI. All right, and then I'm just going to feel on your chest, certain areas of your heart. Start with your aortic. Pulmonic. Verbs point. Tricuspid. And your mitral area. I'm going to listen to your heart in the same areas.
How about we beat Daddy phone? This one died. Mommy, look. This one died.
It's still going.
No.
I'm
Look,
just going to keep going.
it will die.
Over here.
I'll be full, Daddy.
He's my patient, or my son.
Okay. I listened to the S1 and S2. Didn't hear any murmurs or any clicking in between your two heart sounds. Didn't hear any S3 or S4. See, have you had any problems with swelling in your extremities? Okay, just going to check you for any swelling or edema and check your legs. All right. Let's see, I'll have you lay back on the couch there. So you're at about a 45-degree angle.
More or less.
Scoot up a little bit. Okay. Here we would check your jugular for any JVP. We can measure that by going from taking a ruler from your mid-axillary line and from your JVP and measuring where they lined up. And I'll also check your pulses while you're laying there. We'll start here with your carotid. Go to your brachial, which is going to be in your elbows here. Radial. Ulnar.
Let's show me.
Let's see, your femorals would be here. Popliteals. Your dorsalis pedis. And your posterior tibials. You can also check your hepatojugular reflex by looking at your jugular vein Pressing on your abdomen. And waiting for reflex. Any questions? Okay. All right, Brian, we'll go straight into the assessment of your respiratory system. Are you currently having any problems with coughing, chest pain, shortness of breath?
No.
Nope. And you are a current smoker. So let's see, I'm going to start by just inspecting your chest. Just going to watch your respirations for symmetry. Make sure they're not labored, they're regular, they're even. There's no visible masses. We would also measure your anterior, posterior diameter as well as your transverse diameter. I'm just going to look at your back as well. Just breathe normal. All right. Measure your chest expansion here. Have you take a deep breath. Good. All right. Oh, and we'll do the tactile parametus also. How do you say the number 99?
99.
And one more time.
99.
Okay. Your trachea. And palpate over your lung fields as well. Back. Could also measure your diaphragmatic excursion. Maybe take a deep breath and hold it. Okay, and blow it all out. And hold it with all your air out. Okay. I'm going to listen to your lung fields. Deep breath. All right. Hi, Brian. We're going to do an abdominal assessment now. Just start with a few questions. Have you had any recent problems with nausea, vomiting, abdominal pain?
Nope.
Okay. Have bowel movements daily?
Yep.
Okay. Just going to look at your abdomen first. Checking for any visible masses, the contour, the shape, and any waves or pulsations in your abdomen. Okay, I'm going to listen to your abdomen as well, in all 4 quadrants. Okay. We'll listen to your renal arteries for any bruits. And your iliac. I'm going to percuss on your abdomen as well. Percuss over your spleen. Any dullness. And your liver. I'm going to listen as well over your liver. Alright. I'm going to palpate your abdomen. Let me know if you feel any tenderness anywhere. Okay, I'll have you lift your head just a little bit. Okay, you can relax. Let's see, I'm going to need you for this step. I'm going to have you place your hand just directly on the midline of your abdomen. Right like that. Let's just leave it right there. Okay. And then I'm going to percuss on your abdomen one more time, and then I'm going to have you lay on your side. If you want to roll over on your right side, I'm just going to do it one more time. Okay, I'm going to have you sit up for one more. Just need to look at your costovertebral angle on your back and let me know if you feel any tenderness. Anything? Okay, that should do it. Thank you. Hi Brian, we're going to be doing a musculoskeletal exam. So I'm just going to have you stand straight up so I can watch your posture. Okay, and then can you take a couple steps just to the wall and back for me? All right, good, your balance looks good. All right, let's see, I'm gonna look at your jaw first. I'm gonna have you move it, your jaw muscle open and closed. All right, and sideways. Okay. And if you wanna turn around, I'm gonna look at your spine. Take a couple steps this way before we go.
Hold on.
I'm just gonna look at your spine. Palpate your muscles here. All right, and can I have you bend straight forward? Touch your toes. Good. And can you go bend to this each side? And the other side? And then what about a rotation of your shoulders? And the other way. All right, if you want to have a seat, we're going to do your shoulders and elbows and wrists and fingers. So I'm going to do both sides. We're going to work on your shoulders first. So if you want to extend your arm all the way up and then back down. And one more time. All the way down. Okay, then we're going to come out. And then this one will go across your body.
This one?
Nope, that's perfect. And one more time, all the way up and across your body. Okay. And do this shoulder as well. Come up and down. Go out and across your body. I'm also going to do a rotation. So you're going to bring it behind you and pull your arm up. And then same thing, come down and go behind your head. There you go. We'll do the same thing with this arm. So behind your head and then behind your back. There you go. All right, we'll look at your elbows. So I'm going to have you extended up towards your shoulder. There you go. And down. Okay. This one. Extension. Flexion. Okay. We'll do your wrist. We're going to go down and then up. Okay. And then we'll do like a, there you go. And then we'll do up and down. Same on this side, up. Okay, same thing with your fingers. So move just your fingers up and down. And open and close. And then fist and out. Okay. I think that's all for upper body. Okay. I'm just going to assess your muscles here. And have you grip my hands. Good. We're going to move to your hips, knees, and ankles. So if you want to lay back, and check this real quick. Okay, we're going to work with your hip first. So you can either do this with a bended knee or a straight knee. It's probably easier if it's bent. So just bring your whole leg up and down. One more. We're going to do an internal and an external rotation. So to come in this way and then to come out that way. Very good. Do the same thing with this other leg. In and then out. Okay, good. We're going to work with your knee. So it's extension flexion. Same on this knee. All right, that looks good. If you want to sit up, we're going to do your ankle and your feet. So I'm going to have you point your toe. There you go. And then have it go side to side. Same with this one. Point. All right, and crinkle your toes and let them go. All right, that's good.
Thank you.
Okay, Brian, we're going to perform a neurological exam. Just going to ask you a few questions first. Can you tell me your name and your birthday?
Brian Dobb, 10/24/84,
Okay, and what month are we in?
December
Okay, and what year is it?
2013,
And the place that we're currently in right now?
Aniston.
Okay. I'm going to have you, we have already done your mental status exam, which you got all your questions right on the mini mental exam. So we will go into checking your cranial nerves. The first one is smell, which if we had 3 smells, we would have you smell them and make sure you can distinguish those. The second one is optic, which we've already tested on your eye exam, your visual acuity. We can test the other 3 cranial nerves by, if you just follow my finger, oculomotor. Okay. Cranial nerve 5. So it's going to test the 3 parts of your face. And go on your forehead. Just tell me if it feels soft. Feel that? And this one will go on your chin. Same thing.
Yep. Yep. Yep.
Okay. We would also test your taste on the anterior 2/3 of your tongue for that one. And then I'm going to have you make a few facial expressions. Smile real big. Puff out your cheeks. Raise your eyebrows. Stick out your tongue. And make it go side to side. And scrunch your nose. Okay. That's all for that one. Your hearing test we've already done on the eyes and ears portion. Taste we've done. I'm going to watch you swallow. Have you open your mouth for me? Real big and say ah. Okay. And then I'm going to look at your neck movements. Have you go side to side and up and down and shrug your shoulders. Okay. And let's see. We did your tongue movements already. I'm going to have you do a couple things. If you want to stand up for me, I'm going to watch your gait. Just stand, have you walk to the wall and back, maybe. Okay. And then I'm going to do it one more time and go heel to toe from here to the wall. Okay. That's good. You're going to stop there. Have you hop on one foot. Okay. And then this one, you're going to put your feet together and leave your arms at your side and close your eyes. Okay, very good. If you want to go ahead and sit down, we're going to do a couple fine motor things. I'm going to have you pat your hands on your own legs, so you'll go palms down and then palms up, back and forth, real quick for me, as fast as you can. Okay, that's good. And then I'm going to have you take the heel of your foot and run it up your shin of your other leg. Okay, and the other side? Okay, that's good. close your eyes and tell me if you feel a difference, if it's sharp or soft in your palm.
Soft. Sharp.
Okay? Now I'm going to do either 1 point or 2 points.
1, 2.
Okay? And then I'm going to kind of draw something in your hand and you have to tell me what number it is.
8.
Yep. Okay?
Mommy.
And then I'm going to check your reflexes, which I don't have a reflex hammer, but we'll do our best for now.
Oh, Debbie, you have to get up.
Okay, so I'm just going to kind of pretend this is my reflex hammer. Check your bicep reflex here, which it should reflex, you don't have to pretend. All right, we'll check it one more time. Okay, check your tricep. So I'm just going to kind of hold your arm out, let it dangle. So it'll be right there. Your radial reflex would be here. We'll do your patellar, which your feet would be dangling. Go here. Your Achilles, your foot dangling, would be there. And that's it. And then we check your Babinski sign, which should be negative right there. Sorry. All right, and that does it. Thank you.